Dr. Bishop, good
Hey,
morning.
Anthony. Thanks for having me.
Always great to have you. It's
Great to be
fantastic.
here.
What do you think? You think we win Sunday night?
Yeah, I'm hoping we do. It's gonna be a tough one though,
Yeah.
but we beat Detroit last year. We can do it again.
Love it, Doc. I love it. All right, let's
Oh yeah.
talk Travis Hunter and the LCL injury. We know you have not, you're not the primary care doctor of Travis Hunter. We talk about the injury just to try to get us educated on it. The LCL, all right, what does that actually do for lay people like myself when it comes to the knee and the stability of it?
Yeah, so the LCL is or the lateral collateral ligament is one of the four main stabilizing ligaments of the knee. So you have your LCL on the outside, your ACL and PCL inside the knee, and then on the medial or far inside is your MCL. So it's one of the four main stabilizing ligaments. It goes from your outer femur down to your fibula, which was one of the bones in your lower leg. So it acts as a lateral stabilizer to the knee and prevents your knee kind of from going inward.
Do how hard, like when you talk about like the plants, the pivots, like it's integral for that kind of movement, right?
Yeah, it's really important for lateral stability, being able to cut, change direction, things like that. You know, your knee could, with having a little bit of extra motion there when you're turning, it can cause pain. It can cause a feeling of instability, lack of confidence with making those movements, which obviously is very important for wide receiver, quarterback position.
So if you would it affect one position, wide receiver or cornerback, more one of the
Yeah, I mean,
other?
I think it's a good question. I think ultimately it probably affects both, pretty equally. As a cornerback, you're probably backpedaling a little bit more, which isn't quite as much lateral motions, but you've got to be able to turn and pivot pretty quickly, either way. So, I think that based on the fact that he plays both, it certainly makes it harder to come back if you're going to be on the field all the time after an injury like that. But it's either way for both positions, it would be a challenge to play through this injury. That being said, LCL injuries in isolation that he has are actually pretty rare. When
Oh
we
wow.
see LCL injuries, we usually see them in a combination with other ligaments, like you tear your ACL with the LCL or even your PCL with your LCL. So these isolated LCL injuries are much more rare to occur. So that's why it is a little bit more of an unusual injury to see, and kind of that treatment. We don't have as much precedent of,
Hmm.
whether it's without surgery or with surgery. So, it's just something we don't always see with our athletes. But given the fact that he really demands a lot of that knee, he obviously has to have the most, optimal performance for it.
What's the recovery period here?
Yeah. So since he got surgery, it's being described as an LCL repair. There's certainly a chance that he had it reconstructed as well with an extra tendon. They add a cadaver tendon to be able to help stabilize and reinforce the ligament. It's probably 6 months since he had surgery. If he didn't have surgery, and some of these higher grade LCL injuries actually can be treated without surgery, depending on how the patients feel and their level of stability. Those can be anywhere from, a couple weeks to, a couple months to
Oh
be able to
wow.
rehab. Operatively, you can rehab it a lot faster than with surgery. But since he did have surgery, it'll probably be about 6 months recovery for him. So obviously he's
Damn.
out the rest of the
Wow.
season.
That's and how aggressive are you with the rehab period?
Well, I mean, he's going to be getting the best rehab there is for this. So I'm sure he'll be aggressively rehabbing this. But since it's taking him to, next year,
Yeah.
he's got time that he's not necessarily rushing to get back. I guess, even if they make the playoffs, it probably would still be a little bit early for him to come back after this surgery. So, yeah, I think there probably was a discussion whether or not even to undergo surgery for this. Like I said, like there is a
Right.
precedent for treating these without surgery sometimes. But my guess is that he probably had, pretty significant instability on exam that he just couldn't tolerate it. And they needed to make the decision to do the surgery.
Fascinating. Doc, you always enlighten us. Thank you so much. You guys are the great doing God's work. Thank you, Doc.
You're welcome. Go Birds.
Go Birds. How about it, Dr. Meghan Bishop Rothman. We love our Rothman doctors.